is under the umbrella of COCA. Just a brief introduction to Carol's Wish. I think it's best described with our mission statement, and that is that, of course, we deal with gynec cancer patients only, and our mission is to not have anyone receive substandard medical care due to financial reasons. So we kind of begin with that in mind and would address the underinsured or uninsured individuals and assess their insurance policy to see how we can improve on that. And we would take that a step further once we get past those issues. And we can, sometimes this type of diagnosis has a snowball effect in the sense of perhaps a reduction in income, lost hours at the workplace due to treatments, and that may lead to difficulty meeting those everyday expenses, for example, mortgage, rental payment, car payment, and the like. We partner up with grant organizations that can address these type of expenses as well for you. So this presentation is actually part 2 of 2. My colleague Rachel Dyer did the first part where she walked through her portion, which outlines some basic information, guidelines to terms, and so forth. So my portion of this is going to entail walking you through the website for the Affordable Care Act. The website for Colorado is connectforhealthco.com. And I'm going to pull that up on the screen here. We're basically going to just walk through some of those things we need to do to get you familiar with the website so that you can sign up or have us assist you sign up as well. So we're going to walk through getting started on the website. We're going to start as a new customer here. So we'll just click on new customer, and you'll kind of walk through this to go towards the bottom of the screen. As you walk through there, you can certainly go back through this at your leisure and kind of peruse some of these. There's a plethora of information here, so you could go through and see what you can learn from these other links as well. So we're going to go through and compare the plans and prices. Get our welcome screen. And we're just going to put a fake name in here. We're going to put a Jane. She's going to be female. And let's put her birth date at 8/1960, August of 1960. One other question they're going to ask you is whether you are a tobacco user or not, and if you are, you can click on that link, that box there. So we're going to go down a little further and just put in the zip code for a location in Denver. It's automatically going to put up the county for you, which is Denver County. And then we're looking for coverage that's going to start January 1st in 2020. Then they're going to ask the question whether you want to see if you're going to qualify for financial assistance. And of course, that would be yes. That's the reason why we're on this website, so we can get a reduction in the premium if possible. And this is the only place you can actually do that. And then the next question they're going to ask is to help them calculate. They want to know if there is any others in your household. And for our example here, we're going to say yes. And then we're going to put in, Jane has a husband named Jack, so we're going to put him in. And we're going to put in his birth date is September of 1962. We're going to just throw in an amount of money that they make on an annual basis. We'll put in $35,000 for them. So what that tells us is good news. We'll be able to save $524 per month on our premium. That's per month on the monthly premium. It also tells us that it can lower with that income level, it can lower our copays, our deductibles, and co-insurance. But keep in mind that in order to do that, you would need to select a silver level plan from the options available. And Rachel went through in her section of this the gold, silver, and bronze plans. So you can, but just keep in mind that in order to take advantage of the financial cost reduction, you'll need to sign up for a silver level plan. Okay, so we'll continue here. The next thing they ask you is whether, and this is just an estimate, whether you anticipate a low, medium, or high volume of healthcare services for the upcoming year. The low use on the left-hand side here, then they'll kind of walk you through what that means at, 2 visits to the physician, 1 outpatient visit, and 0 at the hospital. So if we go to medium, you can see where that changes. 8 visits with a doctor, 1 outpatient, and 1 day in the hospital. And then we go to high use, which jumps then to 23 visits with a doctor, 3 outpatient, and 2 days in the hospital. And again, just keep in mind that this is an estimate on your part. So we're going to leave it for our example here with the high usage and go forward with that. Then they're going to ask your physician's name, and this is important to put in here because you want to know that your physician is going to be covered in network. So let's just put kind of a common name, Smith. We'll add Whitney to the list. You can kind of see she's got several locations here on the right-hand side. We're going to add one more doctor to the list as well. Add Dr. Jones, who has several locations. So we'll leave those 2. We have 1 for Dr. Jones and 1 for Dr. Smith, and continue to the next level. Then they're going to ask what type of prescriptions you take. And again, this will enable you to determine if that particular plan that you're going to be choosing will cover those prescriptions. The population that we deal with is, again, gynec cancers. So a common drug for those is, a couple would be carboplatin. So we're going to plug that one in. And then you can see carboplatin over here. They're going to then ask you the form of that. So we're going to put injection, and the strength of that drug gives you 1 option. So we'll put that one in. They're going to ask you how many times per year you fill this prescription. Let's say we're going to fill that. Let's say we're going to do it 12 times. Then they're going to want to know the quantity taken. So we'll put in. We're going to put in 30 days for that one. So we're going to add this to the list. So when you kind of go up here, you'll see now that that carboplatin is on the list. Another drug that's pretty common is Taxol, so we'll add that. And again, you need to go through the form. Injection strength is, let's do 300 on this one, and we'll do 6 months, and then we'll change this one to we'll do a 90-day on this one here. Okay, we're going to add that to the list. So now you can go up and see that you've got both the paclitaxel and the carboplatin. So those are the only 2 we're going to put on for this sample. Then we'll head to the next level, and this tells us that there are 58 plans. So there's quite a few plans that will give us that reduction, and now we're going to go into seeing how we can compare the plans. Takes you to this screen, and it outlines for you basically what your monthly premium is going to be at $190.54. You have a savings of $524. So that premium without the cost sharing here would be $714 a month. So quite a bit of savings there. This figure here represents it represents the premium amount of $194.54. So that's $194.54 times 12, since you're going to be paying that 12 months out of the year, and then also your out-of-pocket costs and your deductibles that we'll go through on the other side here. So it's a bright plan. Again, this figure includes that $2,400 annual deductible that is per individual. Since we have 2 people on this plan, you're going to have combined between the 2 will be $6,400 for both of you. So $2,400 for the first person, $2,400 for the second person. So, I'm going to back up on that. Actually, it's annual deductible is $2,400 per person, so that gets a $4,800 for the 2 people. Over here is the annual out-of-pocket expense. So this policy is $6,500 total out-of-pocket, and this would be for the two of you. So I'm just going to run by that again so there's no confusion. The deductible on this policy is $2,400. The annual out-of-pocket max is $6,500. But again, those two figures, depending on the income level, might be reduced as well because of your tax savings. So then over to this last column here, this will tell you, the very first one with a little man on there, it will tell you which physicians this Bright plan accepts, and this tells us that it's not accepting either Dr. Smith or Dr. Jones. So you want to go a little further down and see which policy is going to take your physicians if you want to keep with those physicians. The second little icon here tells you which prescriptions this particular Bright plan will cover, and it will cover carboplatin, but this particular policy will not cover the Taxol here. So you want to keep going down. This particular policy will cover Dr. Jones, but not Dr. Smith. So keep going until you want to get to a point where you can have both of the prescriptions covered and both physicians if that's your desire. This one does cover both prescriptions here. The feature on the last column is an ability to compare the policies. So you pick out 2 or 3 policies that you think is going to work for you, and you do a little check mark there on that one. We'll do a check mark on this one. And you go back up to the top, and you can compare those 2 plans that you've chosen. So it does give you a little more detail, and it's side by side, so you can say your yearly cost. Again, that's with the annual premium and your max out of pocket, your monthly premium on each of these, and all the way down the line on all the little details, so you can make that comparison. So that's basically walking through the marketplace plan here. That'll get you started on it. We're going to go back to our other slide here. So I just wanted to end with saying that we have 2 advocates here at Carol's Wish, both Rachel Dyer and myself. There's our contact information with telephone number and our email address. Feel free at any time to call with any questions you have. Hopefully this is helpful walking through these, and I appreciate your time. And again, feel free to call us with any questions you have.